What is normal today, it may be abnormal tomorrow. The concept of normality and abnormality. Myself Sukumar, I am the student of occupational therapy. A behavior in one culture or one society may be normal, but same behavior in another culture or another society may be abnormal. How can we conclude normal and abnormal behavior? Okay, let's view the terms. What is normal is a term derived from the Latin word normalis, which means carpenter square. So they uses norms, they uses rules and regulations. So that is normal. So the word itself says it has a standard and it has a rule. Okay, what the term abnormality means? It is comes from the word anomalies means not regular. So it is not regular behavior, or it is the opposite to the normal, abnormal. So it is directly opposite to the normal behavior. So normality is a typical pattern of behavior or typical personality trait. So typically all the people are like that. So if the person are also like that, then he is a normal person. If he is unusual, he is different from other traits, means he is abnormal. Describe 10 characteristics of normality person, which means the person having a normal personality. So they have these characteristics. First, they have adequate feeling of security. They are secure. They feel like that. Adequate emotion. They have some emotions. Adequate self-evaluation, which means they can calculate what is happening in their body. They can calculate if they are hyper or hypo. They can self-evaluate themselves. Adequate desire. So they have the desires. They have the targets by himself. So it can be achievable. So that's like targets he have. Self-knowledge. So what are all happening in himself, it is known by can't make. So he have the realistic life goal. He have the ability to learn from his past experience. If he do a mistake in the past, he can able to learn from his mistake. He has the ability to satisfy the requirement of the group. So if a group, he is mind in a group, then the group needs some characteristic from him. So and then he can able to give the characteristic. So this ability he can have. So these 10 personality traits is a normality. So it is described by Maslow and Mittelman. Abnormality. The word itself says it is away from normal. So these traits are not present in the abnormality. Has many more criteria. So to diagnose it is abnormality, they have many more criteria. Personal distress criteria, which means they are personally feel stressful, feel unsatisfied. That like, so he are doing some behaviors, right? So this behavior are stressful to him. So if it is continue like this, it may be the abnormal behavior. In this personal distress criteria, so these behavior can be assessed by own. So if I am the person doing the stressful activities, stressful behavior for a long time, then I can also assess what are the properties happening in my body. So what is the problem, what is the behavior, is it good or bad? It is diagnosed by me itself. Then disability criteria, in which the person used to do the behavior very well. So before he is doing very normally. So after that, after injury or after any accidents, he can't be able to do the same behavior he used to do better in past. So this is called disability criteria, in which they lose their normal behavior due to the physical disabilities. Then criteria of unexpectedness, which means the person doing an abnormal behavior unexpectedly. He also don't expect his behavior like that. So it is abnormal. For example, if a person lose a loved one, so he should cry. So it is an expectation for all. So but he does not feel sad and does not cry. He is laughing at the same time. This is a unexpected abnormal behavior. Many psychologists believed that 4D criteria as easy to assess the abnormal behavior. What is 4D criteria? It is developed by the Comer. What are all the 4D? First D, deviance. So it is deviated from the normal behavior. So that is deviance. Then distress. It should be stressful for himself or stressful for the society. Then dysfunction. So he can't able to do something. So that is dysfunction. Danger. What is he is doing? So his behavior should be danger to the society or danger to himself. That is the danger. So these 4D criteria is used to assess the normal and abnormal behavior. Okay, I am going to say some characteristics, so which are all described by the Maslow and the Mittelman. So for abnormal trait, So what are the abnormal traits having? First, they are suffering from unhappiness. So they don't feel happy, they are suffered from unhappiness. They have less efficiency, they can't do more work, they have less efficiency, they can't adjust to the environment, they have poor adjustment. So if the road is just like that, they can't adjust, so they are very irritated. That like behavior is so less enjoyment in the dance class anywhere. So it is an enjoyable place, but he can't able to enjoy. He avoid the enjoyments. Then lack of insight behavior. So what is happening in himself is not known by him. He may be sensitive or having tension. So sensitive means if the person is emotionally attacked, so the person may cry. That's like, so they are very sensitive and having tension, so having anger on some members and become a stressful person, and lack of satisfaction. And what are all we said in the normality traits? I already described the characteristic of the normality, so same opposite are all the characteristic of the abnormality. For normal and abnormal behavior we have 5 models. So what is the theory given by some members? So that theory saying what is normal and what is abnormal behavior. First model, biological or medical model. So in this first abnormal behavior, biological model says malfunction of the brain only cause the abnormal behavior. So if the nutrition, biological factors, organic factors are all correct to him, so the brain can function normally. So then he have normal behavior. So that's like the biological model says about the normal and abnormal behavior. Second, psychodynamic model, which in this psychologically they are affected. So if the problem in the relationship, then he have the abnormal behavior. That's like these models explaining. So if the person have the problem in a relationship or any psychological relation, so he reflect abnormal behavior in everything. According to the psychodynamic model, so the person are unconsciously having the abnormal behavior. Then that behavior model, in which the person behavior, so past behavior, so how he experimented, so that like he is acting. So that is the, that may abnormal to the society, but they are experimental like that, and they do like that. Example, if the person sees fight scene in the movie, then he do like that. So it is experimental and he doing like that. So there is a behavioral model. Then socio-cultural model, what the society say, what the culture says, so that affect the normal person's behavior, and it change the behavior into abnormal. That is the social cultural model. So this model says social and cultural factors are influencing the abnormal behavior. Then statistical model, in this, so there is a average. What is statistics? It is a average value. So if the whole population have a average personality traits, if the person limits unlimit the normal average level, so then he is the having the abnormal behavior. So one statistical report is there, so this is average. If the person beyond this, so then he is abnormal. So that is the statistical model. So using the average value, we are determining the abnormal behavior. So the society says good and bad, so good for normal and bad for abnormal. So ourselves says good and bad. So that's like, so we are also having some traits. So society have some traits, it is not constant. So what is normal today, it may be abnormal tomorrow. So that like, so anything, nothing is good or bad mindfully. So what are all doing should be mindful to you, so then you can do well. So thanks for watching, be proud to watch this video. I need your support because I also need motivation. Kindly subscribe. Thanks for watching.